So it's a great pleasure to present the results today at the EHA meeting here in Madrid on behalf of all my co-workers from the study Alliance Leukemia. RELAZA2 investigated Azacitidine in measurable residual disease positive patients in MDS and AML after conventional chemotherapy or autogenic stem cell transplantation. And of course we only included patients in CR or CRI. We did a regular MRD assessment every 3 to 4 weeks at the beginning, and if patients turned MRD positive, we treated them with AZA for the first 6 months. And then we did a first response assessment. If they responded, we decreased the dose a little bit. If they didn't respond, we increased it. And at the end, patients were treated for up to 2 years. And today I'm very happy to present the long-term follow-up results. It's now in median about 23 months. We followed up our patients, and we can say that from the initial response perspective, 65% of included patients and treated patients responded to AZA. We divided it into major and minor response. Major means that they already turned MRD negative after AZA. Minor MRD response means they are still MRD positive, but didn't have a relapse, and also no clearance of MRD. And we could show that especially in the relapse-free survival and overall survival, major MRD responders are superior. They had a significant better outcome compared to non-responding patients, and also in contrast, especially in the relapse-free survival setting, compared to patients with only minor response. And we could also say that during our long-term follow-up in major responders, it was about 28 months, that more than half of our patients with an initial response sustained this response without any hematological relapse. They stayed alive. And we were also able to show that they were able to stop AZA treatment. And in median, it has been around 20.8 months without any AZA treatment, and they are still in hematological free remission. And therefore, this is also our conclusion. We can say that RELAZA2 shows also in a long-term follow-up perspective that it is safe and it's able to delay hematological relapse. And if patients respond, we see some long-term responses. And we were also able to identify some biomarkers of response, like lower MRD level at the beginning, long time from last treatment, and also favorable ELN risk. This was some predictors with a better outcome and MRD response after Azacitidine. We did not only show that we have some long-term responders, we were also able to show if patients initially respond to AZA but then again had a relapse. We were able to show that Azacitidine treatment was able to delay this hematological relapse for around, in median, 13 months. And it's also important, of course, to have a look into MRD negative patients, and our long-term follow-up also provided some data about this. Patients having a complete MRD negative course without appearance of MRD, they had the best outcome compared to our MRD positive patients in regard to relapse-free survival and overall survival.